is putting safety nets following drugs meant for public hospitals being sold by private pharmacies. As such, they have said they are putting a tracking system to these drugs so that they could be easily traced to the pharmacies. It's mind-boggling. You are putting a security system already. You are alarming pharmacies that there is something of that nature that you are putting in place to keep the stealing from the public hospitals. Is that not conscientizing these private pharmacies to also implement measures to make sure that you don't successfully track them? According to the government, numerous drugs meant for the members of the public are stolen from the public hospitals and distributed to private pharmacies. Greetings and welcome to your lovely channel, the Hlonipani Global News. If you're watching us for the very first time, please do remember to press the red or black subscribe button so that next time when we beam live, you become the very first one to watch us. After realizing that public hospital drugs are finding its way to the private pharmacies, the government of Emerson Mnangagwa is said to be implementing tracking measures to make sure that they catch the thieves. And according to this publication, it says the Ministry of Health and Child Care has been forced to install a tracking system to monitor the movement of medicines from net farm to public hospital and pharmacies amid growing concerns over the rampant theft and resale of drugs meant for patients. I think Zimbabwe is a crime scene. I wonder whether they are starting everywhere where their government actually products. Definitely, there is corruption. It says medicines leakages have been a long-standing challenge in the country's public health system, with diversion of drugs from public facilities potentially depriving patients of medicine supplies for government programs. The problem also places an additional financial burden on the health sector as the government has to replace medicines that are lost before reaching the intended beneficiaries. Health Deputy Minister, that is Suleiman Kwidini, acknowledged that the government was losing significant amount of money through medicine leakages, with some individuals allegedly stealing drugs from hospitals and reselling them through private pharmacies. After medication is purchased, some people steal it from hospitals for resale through pharmacies. Putin confirmed in Parliament recently. We have noted that in every home there is a troublemaker, but I want to clarify that the government is losing a lot of money through leakages. He said the system had already been installed and would help identify where medicines were being diverted from the public health system, thereby protecting medicines in the public hospitals. We now have a tracking system in place, but do reveal such things to the members of the public. Does that not arm actually thieves to come up with another strategy to counter your strategy? He says we now have a tracking system in place. He said, in fact, the deputy minister also revealed that the Medicines Control Authority of Zimbabwe was working on regulations concerning pharmacies operating near public hospitals. We spoke about the designated meters which are allowed, or the actual distance from such a hospital. As I am speaking, the Medicines Control Authority of Zimbabwe is in the process of promulgating such laws, he said. So they're now going to, they're not going to allow pharmacies near the hospital. But that doesn't it compromise, because in Zimbabwe, you buy medicines. The public hospitals, to be frank with you, they don't have medicines. So medicines are, what public hospitals does is write prescriptions. And then you have to look for the medicine to the pharmacies. So if pharmacies are strategically stationed near the hospital, it is an advantage to the patients needing medication, especially, or medical actual equipments. That I understand in Zimbabwe, even if you want to be operated, you buy everything that is needed for you to be operated. Yeah, it's a shame. Medicines you buy for yourself, you buy equipment. So if pharmacies are stationed far away from the hospitals, let's look at the patients who don't have cars, who can't afford cars. The economy, in fact, make it difficult for the people of Zimbabwe to afford these things. So saying you are going to make sure that there are no nearest pharmacies near a public hospital, that on its own may disadvantage the patients in an effort to try and regulate theft. I think there are better systems to be put in place to regulate theft rather than this. This is actually, I don't support this in my view. He says the deputy minister also revealed that the Medicines Control Authority of Zimbabwe was working on regulations concerning pharmacies operating near public hospitals. I was speaking about this. We spoke about the designated meters which are allowed, or the actual distance from such a hospital. As I am speaking, the Medicines Control Authority of Zimbabwe is in the process of promulgating such a law, he said. But you know, this will be a very primitive and unnecessary law, so to speak. Community Working Group on Health Executive Director Itai Rusike said theft and leakages of medicines from the public sector had contributed to the emergence of parallel and informal drug markets. Where cost and availability barriers exist, communities may purchase drugs from these markets. Rusike said the problem with such sales is that they are unregulated, making it difficult to ensure the quality or appropriateness of drugs, avoid side effects and complications, and also prevent problems of resistance, as would happen in the unregulated use of antibiotics. He said communities could play a role in strengthening the tracking system by reporting medicine leakages, theft, the improper use of drugs, and unregulated drugs markets. Communities can also assist the tracking and monitoring system initiated by NatFarm through whistleblowing on leakages, theft, improper use of drugs, and unregulated drugs markets. Rusike said they can also monitor the availability of vital drugs, particularly at the health facility level, where supplies have fallen drastically. The theft of medicines comes again against the backdrop of chronic drug shortages that have plagued the country's public health system for years. Health facilities frequently report stockouts of essential medicines, including antibiotics, painkillers, and life-saving drugs for chronic conditions such as diabetes and hypertension. And also I sense a government that has failed, in fact, to procure such essential drugs, to blaming it to theft. There is high probability that may be the issue at stake here. They are failing to procure drugs, and then as an easy way out to try and justify that, they say the drugs are stolen. I don't think all the drugs can be stolen to such an extent that there are no drugs in public hospitals. someone is not saying the truth here. Thank you very much for watching us. If you're watching us for the very first time, please do remember to press the red or black subscribe button so that next time when we beam live, you become the very first one to watch us. You can financially support this channel by pressing the join button and be part of our members who are the heartbeat of this channel. You can equally do so by pressing the thanks button and send